Hi guys, so this is the second part of my diabetes video. So in the first one I kind of just talked about the meaning of diabetes and some history about it and how it happens. Today I want to talk about you and your risk factors. So a couple of videos ago I talked about risk factors, and a lot of chronic diseases that we have, they have a lot of similar risk factors, and I talked about modifiable and non-modifiable risk factors. So today we're going to talk about the specific risk factors for diabetes. So I'm going to start off with non-modifiable risk factors. So these are the risk factors that we have that we can't do anything about. So last time I talked about how diabetes occurs over a long period of time. So the older you are, the higher risk factor you have of having diabetes. Now, this age limit isn't the same for everyone. So age and race are kind of combined risk factors for diabetes. So for example, in the UK, if you're Southeast Asian or Black, the age of onset for diabetes is from 25 years old, but it's different for white race. So if you're white and over 40 years old, then that's when you're more at risk for getting diabetes. Another one is family history. So if you have a family history, especially your immediate family of somebody who has diabetes, this puts you at a higher risk of having diabetes. It's also been found out that men do tend to get diabetes more than women, so sex does also play a role in this. When it comes to non-modifiable risk factors, we can't change it. You can't change your race, you can't change your age, you can't change your sex. This just makes us more aware that we're at high risk of getting diabetes, which means we pay attention to what we eat and the lifestyle that we're leading. Now I want to talk about the modifiable risk factors. So these are the ones we can control. So the first one is being overweight. Being overweight is usually a combination of having a high calorie diet, maybe a high sugar diet, and decreased physical activity. And this equals to having high blood sugar. And as I talked about in the last video, having high blood sugar for a prolonged period of time, that's what causes diabetes. And of course, the biggest risk factor for all of this is diet. So if you have a lifestyle of eating high fat, high sugary foods, this is going to increase your chances of you getting diabetes. Another modifiable risk factor is smoking. So smoking is known to damage your blood vessels. And as I talked about in the last video, you're not supposed to have a lot of sugar in your blood vessels because it damages your blood vessels. So if you're smoking and also having lots of sugar in your blood vessels, you're just having multiple factors that are damaging your blood vessels. And then once your blood vessels start to get damaged, you start having lots of the signs and symptoms that I talked about last week. And another thing which also damages your blood vessels is having too much fat in your blood vessels. So having a lot of cholesterol. And another risk factor which is associated with damaging your blood vessels is hypertension. So hypertension is usually caused by lots of other different things, but diet is also a big factor in this. Another risk factor which is specific for women is gestational diabetes. So this is diabetes that starts when a woman is pregnant and usually goes away a while after she's given birth. But if you've had gestational diabetes before, it does increase your risk factor of getting diabetes later on in life. So when it comes to treating diabetes, the first thing you're going to be told to do is to change your diet and increase your physical activity. Lifestyle changes are the cornerstone of stopping the progression of diabetes. Many people through their diet and exercise have been able to stop and reverse the progression of diabetes. This is because with decreased input of sugar and increased exercise, your blood sugar levels are going to be low, meaning your pancreas is getting a rest. If maybe there's not that much damage that's been done, your pancreas is able to heal and it's able to work at the normal level that it's supposed to. If diabetes has progressed to a point where your pancreas is decreasing in its function and it's not producing that much insulin, sometimes that's not reversible. And if your pancreas has just stopped producing any insulin at all, then you can't really reverse the damage that's been done. That's why there's also medications, but first it's diet and lifestyle, and then if it's progressed, then you start taking medications. So last time I talked about the stage of diabetes where maybe your pancreas is producing all this insulin and it's trying to get all the glucose into your cells, but your cells are not sensitive to the insulin. So one of the first medications that people get is called metformin. So metformin makes your cell more sensitive to insulin. So that means you're taking up a lot of the glucose in your blood, decreasing the level of sugar in your blood. But this works as long as your pancreas is still able to produce insulin. For some people, there's too much damage to the pancreas and it's just not producing enough insulin to keep you going. So this is why later on people start taking insulin. So since you can't produce your own insulin, you start injecting artificial insulin because this does the job that your pancreas should have been doing. So this is kind of like the basic progression in treatment for diabetes. You always start with your lifestyle. You always start with your diet and increasing your physical activity. You go on to metformin and insulin. Key to diabetes is controlling it, because if you don't control it, some of the complications, some of the things that happen later on from not controlling your diabetes are things such as going blind. So I talked about this last time. The sugar starts affecting the very small blood vessels, such as the ones in your eyes, and if you don't control it, eventually it's gonna just destroy the blood vessels in your eyes and you go blind. It starts messing up with the blood vessels at the tips of your fingers and your feet, and you have cases where people basically they're not getting any blood supply at all in their extremities, and they go black and they die and they have to have them cut off. So you have people who have maybe some fingers cut off or some toes, or sometimes the whole leg will be taken off. So I worked in a place where we had a few people who had diabetes and they were amputees. They had to have their legs cut off. It's also known that because you're damaging your blood supply, when people who are diabetic, maybe they get cut or they're hurt, or even when they go to surgery, it's a risk factor because they don't heal properly. So you might not even be able to have a certain type of surgery done. Left uncontrolled, it will destroy your body and eventually it's going to kill you. So the question is, how do we prevent getting diabetes? The main thing is controlling our blood sugar. And how do we control our blood sugar? We control the sugar that we put in our body, so that comes down to diet. So what foods have glucose? What foods have sugars? What foods have carbohydrates? It's easy to think of high sugar foods like cakes, cookies, biscuits, donuts. But sugar's also found in fruits. It's also found in vegetables, all sorts of vegetables, also in grains, and also in beans and dairy. As you can see, we can't escape carbohydrates, we can't escape sugars, and we shouldn't be, because we need glucose. Most carbohydrates, when they're broken down, they all are broken down into glucose. This is why if you try to not eat carbohydrates or try not to have a lot of sugar, you feel tired, you get a brain fog. That's because glucose is needed for our energy. When you don't eat enough carbohydrates, you become tired. So we need to have carbohydrates. But not all carbohydrates, not all sugars have the same effect on our blood. Not all of them have the same effect on our pancreas. And this is what I'm going to talk about in the next video. I'm going to talk about which type of sugars, if eaten constantly, are going to end up having a damaging effect on our pancreas. But there's types of sugars that we should be focusing more on because they provide us with the energy that we need, but they don't have a damaging effect on our pancreas. So stay tuned, and all that's coming in the next video. Thank you so much for taking your time to watch this, and I will see you next time.